Good evening, ladies and gentlemen. It is 6 o'clock, so I will call the Trempealeau County Board of Health November meeting to order. I can also certify that the open meeting law requirements have been met with the proper postings. And the first item on the agenda is a public comment period. We have allowed 15 minutes of time if needed for public comment. So I'll open up the public comment period. I don't know if anyone wants to call in. I believe the number is 715-538-1770. Is anyone here that wishes to speak? This is my second call for public comments. (715-538-1770). Yes, sir.
I was just wondering.
Could you come up to the podium, please?
I
Oh.
was just wondering if we could have a public comment at the end of the meeting instead of the beginning.
It's always been at the beginning of the meeting. Do you have something you want to comment on an agenda item?
I guess I might, but I would just soon wait till the end.
The committee members, do you have any objection to waiting or having public comments at the end?
Nope.
Then I guess we could have you speak at the end if you wish to. Otherwise, this is the third and final call. If there's anyone in the public that would like to speak, you can call 715-538-1770. Since no one is calling in and the people who are here might wish to speak at the end, I'll close the public comment period at 6:03. We have an 11-item agenda, and we need someone to approve the agenda. Okay, it's a tie.
Second.
Okay, Mr. Feltus will approve the agenda, and Mr. Johnson is going to second. Any questions about the agenda or changes? Hearing none, all those in favor of approving the agenda say aye.
Aye.
Opposed? The agenda is approved. Now, number 4 is approving the minutes from the October meeting, which Carol had sent out last week, I believe, already. We need a motion to approve those.
Move to approve.
Second.
Motion by Johnson, second by Feltus to approve the minutes. Any questions, changes? All those in favor of approving the minutes say aye.
Aye.
Aye. Opposed?
I'm going to abstain.
Okay, Bridget will abstain. Bill, are you okay, and Bill will abstain. So we have 3 out of the 5. The minutes are approved. We do have a new board member representing District Number 1, I believe, Bridget Turner. Do you turn on your mic and give us a little info?
Okay, my name is Bridget Turner. I was asked to fill in for a board member who's no longer in the area, and I can tell you that I'm honored to be a part of the Board of Supervisors as well as part of this committee. I'm currently serving on the Village Board of Trempealeau, and I have done for the last about 4.5 years. And I've really enjoyed that, so I'm looking forward to serving the community on this committee as well. Thank you.
Thank you for joining us. So we have a review of this consolidated contract with the discussion of the objectives.
All right, thank you. Yeah, the review of the consolidated contract, just more of an education session. Every year, we have a number of contracts that we get money from the Department of Public Health at the state. Those contracts are currently in negotiation. They'll be finalized by the end of the week. Just wanted to, make you aware, I guess, of the things that we'll be working on next year. And one of the larger pots is the maternal and child health. And we'll be pursuing 2 different objectives under the maternal child health, and that is adolescent mental health. Really thought that would be important given the COVID and the kids and the schools and all of the mental health issues with that, and trying to coordinate efforts between the schools, human services, the health department, and I'm forgetting one, but in healthcare. So we'll be working on anti-suicide training in the schools and anti-bullying training, starting out just assessing what is available and how many different things there are, with maybe a long-term outcome of trying to get everybody on the same page or at least go in the same direction with some of the material. So not trying to dictate any one evidence-based practice over any other, but just trying to see if we can get the group together to come to some sort of county-wide strategy on those things. We'll see where that goes. The other one is health equity. Health equity is the foundation of public health, and there's, making sure that everybody has, we're removing barriers for access to care for a number of folks who may have extra barriers. So a couple of those things are going to be working with community groups, including leveraging our great relationships with the K through 12 schools, and we will, and other maternal child health groups, probably some WIC folks, to work on a community engagement assessment tool and some foundational practices, and we'll collectively, as a group, decide on one in each of those tools, one objective in each of those tools, and within the first quarter, on an intervention that we can start to work on for the next year with health equity. So another
Board of Health meeting. Because nobody requested a WebEx. So Drew is here, maybe he could put you on speakerphone. Okay, Carol, you want to get Drew, because both Dr. Kim and Sally are
Where you want?
ready.
Over there?
Yeah. Carol will go and see what we can do. Hang on. We have a quorum, yes. We have 5. Right, but just hang on till Carol comes back with Drew. Sally said she did have a WebEx link.
Yes. Tonight and UCC. Sorry about that.
No, it's no problem.
Drew's going to work on it. Might take a couple minutes. Yeah, and she just gave that to Drew, so it might take a couple minutes. We'll just put a pause. Okay, the two of you can chat together, but you can't chat with us. Okay, bye.
Sally?
Sally, she and Dr. Kim are both there. They can talk to each other, but they can't talk to us. So we'll put a pause until Drew lets us know if he can get them in.
With the smile. Not on camera yet.
Thank you. You just dated it. You didn't
Oh
say
my
it.
gosh.
That's why I get the big bucks. Thank you for having that paper. Oh, no problem. I'm glad that you noticed it was there. I haven't tried to use that yet. I haven't tried it to see to call in or to do anything like that.
It's pretty easy to do
But-
if they set it up.
Yeah, but I figured I do want to set it up in case the roads get really bad.
Oh, yeah, good idea.
You know, because if they're not good at 6 o'clock, they're not going to be better at 9, probably.
Oh,
When
absolutely.
they're
I'm
getting
driving
stuff
from
done.
Trempealeau.
Yeah.
You gotta go over that hill.
And I'm not a big fan of driving at night anymore. But if it's ice, no.
I know.
don't know your ice.
Do you have email? Yeah, you could write me an email
Sure.
address, 'cause I didn't get that.
I'm assuming you want the county one, right?
Do you look at it? Do you?
I looked at it yesterday, and I just have one, I had one email that was from the sheriff welcoming me to the board.
Okay.
That's it, but I don't have it
Well, at least
memorized
we
yet.
know it works.
Yeah, it does work, everything works.
Oh, you did?
Nice.
Sorry, Aaron, to stop you in the middle.
I was gonna try to make it fast today. We might not get that.
No.
There you go.
Thank you so
Sure.
much.
You think we'll make the December?
Probably not, because we'll be up in the hotel, up in the cities, and I'm not taking all my computer stuff along.
For the county board,
So-
separating what I have from the village.
Oh, yeah.
Because we just finished our budget stuff for the village, and then of course we were here, and I was like, kind of had it all together, so I'm like, shoot. And then filing it, and, you know, trying to see, I'm hoping that the computer thing works good, because I like making notes on the
Yeah.
computer and stuff like that,
Yeah.
so we'll just see how it goes and I can work.
So now, do you have to run in April?
Yes, and I actually have to run for the village too.
So you have to take out papers now in December here, don't you?
Mm-hmm. And they left them in my mailbox already, so
Okay.
we'll get Thursday, we have a village board meeting.
All those who want to help, and then suddenly to be able to do it here.
Yeah.
There they are.
I can hear somebody.
Hello.
Hello, we can't see you, but we can hear you.
I see him right here. We can see him right here.
Oh, well, I can't see him on my,
I think that
My screen.
TV's off totally.
so we have both Sally and Dr. Kim, yes?
Yes, thank you, Drew. Thank you.
All righty. Aaron was in the process of talking about the Consolidated Contract. I don't know if you want to start from the beginning or,
I'm going to start from the beginning, and I'll pause to wait for Joe,
Joe?
When we get to where I was. But I'll briefly go over it. Talking about consolidated contracts, just an education on kind of what the money is going to be used for, provided by the Department of Health for 2022. We have a number of grants, and the first one is the maternal child health that I started to cover, and we have 2 objectives that we signed up for this year. The first one is adolescent mental health, and excuse me, that will be to work with healthcare, human services, the schools, and the health department to work on suicide and anti-bullying sub-objectives, I guess, of the adolescent mental health, and I thought that that was particularly important, giving the extra stress put on that particular population with COVID over this past year, so past 2 years now. The second one was very important, and the foundation of public health and everything that it stands for moving forward, and that's going to be health equity, and we'll need to collect, assemble some groups, some maternal child health groups. I foresee working very closely with the schools and complete a community engagement assessment tool, and also select one objective out of that tool with the group's decision that we'll work on for the remainder of the year, and then another tool, a set of foundational practices in health equity provided by the state. That group will also help us select another tool from the foundational practices that we'll decide on sometime in the first quarter. And then that brings us to the Preparedness Grant, and so that's where you guys called in, and so we'll just wait for Joe. Joe had just stepped out right before you guys called, so we'll just give him a couple minutes.
sure. This is a pretty informal group.
All right, I'm going to go ahead and jump back into it. I stopped, so we're reviewing consolidated contracts. The next one is the Preparedness Grant. This is a flexible, small pot of money from the state. It allows us to work, we're going to use it for community health improvement planning. So this is something I asked about in my interview, you might remember. It's also something that we have to do every 3 years at the county. And so the Great Rivers United Way provided us with the Compass Report, which will serve as our community needs assessment. That's required, and then we will use that community needs assessment to work on the Community Health Improvement Plan. And so we'll have Bree work on this, and we'll use a number of partners to help us inform and do some focus groups and some key informant interviews on setting a longer-term 3 to 5 year strategy for the health department and the work we do there. So we will use that pot of money for those required activities. Next one is WIC. I think important, fairly self-explanatory. I'll move on to the vaccines for children. It's a statute required service provided by public health. We have our objective will be to ensure that 76% of the children under 2 years of age are up to date on their current vaccination schedule. And then the final contract objective that's up for negotiation currently is the childhood-led contract. And unfortunately, I don't have the exact percentage, but it's a certain percentage of making sure that a number of the under 6 years old population in the county get a blood level screening, blood-lead level screening. So pretty typical stuff. So those are some of the things we'll be working on for contracts. And I guess questions? Does anybody have any questions? More of just a awareness. Can we move on to number 7?
Sure. The
Okay.
number 7 is the Director Health Officers Training, quarterly meetings.
Sure. Again, just another awareness piece that oh gosh, who puts this on? WALDAB. So that's the Wisconsin local boards, local health board and health departments association. Association of Local Health Departments and Boards, WALDAB. They put on a training. They haven't done it for a couple of years because of COVID. It's the first one they've done since November of 2019. There were about 30 new health officers there. I don't have the exact number. It was a lot that have been hired over the last 2 years because of the turnover. Has been high. And just a couple of things that we talked about at this training. It's a quarterly training for the first year. And we talked about human health hazards, something that I happen to be familiar with, but most health officers are not. There's a question and answer period with a recently retired veteran health officer that provided a lot of insight. She talked to us for a couple hours. It was Joan Thur from Marathon County about the job and the changing nature of the job. It was quite interesting. There was a discussion put on by the state about the public health statute and rule discussion, and just describing the legal aspect of the work we do, and then obviously the networking and getting to see a number of these folks I've met over Teams and Zoom and stuff for the last couple years, both in La Crosse and here, and it's nice to meet them in person. And I also want to note that I know you guys have always had an RN as a health officer. Half of the people there that were the new health officers were not RNs. And so public health is changing a bit. And some of the things, like myself, environmental health was, there were 3 of us there with an environmental health background, a number of folks with their masters in public health. There was a business MBA, a dietitian, a health educator. There's a master's in public health administration and a social worker that all filled these different jobs. So just the changing face of public health as we evolve. And so just wanted to let you know that these trainings happen, and that the state and these other organizations are providing that training, and in general, we're on the same page. So,
Any questions or discussion? Then we can move on to number 8 with the director's report about the COVID updates with the clinics in the schools, the WIC updates, starting date of November 29th of the new hire, environmental health, and the public nurses, reviewing of the policy change, which I believe we made last month.
Okay, thank you, Beth. Director's report. So we'll start with the COVID numbers. Things today, this year are worse. The case numbers are worse now than they've been all fall since the spring. We're at 68.4. That's the daily cases per 100,000. That's just the rate. It's a 7-day rolling average of 68.4. That's well within the red. Anything over 20 is in the red, and it is ascending. Last week, the cases were at 50. For full context, tomorrow, 1 year ago, we were at 207, and that's when things were at their absolute worst in this community with COVID. So the full picture perspective, we're doing better than last year, but still things are not good. We're getting a number of cases. There was a lull for about a month, but they are picking up. We have 26 new cases today. There are 167 active cases. There are 3 hospitalized. And again, just a reminder that all of these numbers are folks that reside in this county, so there may be more people in the local hospitals, and they may be in other hospitals, but if their home address is here, that's what these numbers are for. And just to note that, anecdotally, the hospital beds and ventilators are in short supply throughout the entire upper Midwest right now. There's a number of folks that are having to get sent over 100 miles to find a bed periodically. It changes from day to day, so just something to note.
Just Trempealeau County, or is this Wisconsin?
The hospitalized?
The numbers that you're talking about as far as the new cases and that kind of thing, is this
Trempealeau County.
Just
Trempealeau County. Yep. And fortunately, we're still at 49 deaths of Trempealeau County residents here. So we haven't had a new one of those for quite a while, a month or so. I'm grateful for that. We'll move on to the vaccination efforts. We're holding a lot of vaccination clinics for boosters, and including the pediatric doses made available. Again, everything is voluntary, but in a number of the schools, and just in this past week alone, we've facilitated over 500 doses of COVID vaccine, both pediatric and mostly pediatric doses. It's mostly boosters, though. There's another organization that has a clinic at a local restaurant in Arcadia that's focused at the Latino population, and they're doing that 4 days out of a 5-week time span. So we're halfway through that. I haven't heard how that's going, but it's nice to know what's happening. And let's see. Move on to the WIC update. I know that on the agenda it says the start date for November 29th was a new hire. That changed the day after this agenda went out. She rescinded her acceptance of the offer. The nature of the requirements for that position, being a dietitian, they don't graduate in the middle of the year, so we're choosing to wait to post until the end of the spring to try and catch some of the new graduates that might be available at that time. So that is unfortunate. Let's see. The emergency has been extended at the federal government level, which means for WIC that there'll be no in-person services. They're doing everything over the phone with clients until at least the middle of April at the earliest. So just awareness there. Every time they extend the emergency, the federal emergency, the WIC in-person will get delayed. On to environmental health. We're continuing to train for restaurant inspections for Dexter, so making progress on that. Really hoping to have him up and out on his own by the end of the year. And he signed up to take his RS exam at the end of this month, so wish him luck with that. It's a tough test. Standardization is a practice through DATCAP where they go through the food code, and the food code has a number of different rules, and the idea is that the standardization is a practice where they have to answer yes or no or not applicable or not observed to all of, like, it's over 800 possible permutations of a rule that may be interpreted. So that's pretty tough as well. She's going through that training to become standardized herself with the state. Then she'll go through the training, continue the training to become the standard so that she can do that for our own staff. So that's quite a task, and she's currently about halfway through that process. And then we had a positive rabies bat this month. I thought that was interesting. That doesn't happen always, but sometimes pets or people find dead bats or are in a room, and they bring the bat in, and we send it off to be tested. They test its brain for rabies, and if it comes back positive, then there are obviously other steps that a pet or a person should take, and we advise them on that. So, nursing, we implemented a new immunization policy, which we talked about last month. It's going well, and then we had the state immunization folks come and observe a couple days later for a process analysis. And so that occurred. There have been notes. There will be significant changes to our immunization process. I like to draw the restaurant analogy with the way that it's been happening. Seems it's like the way we've been doing it, the person is how you might do it at your house. Like, there's one person that greets you at the door, they sit you at the table, they make you a drink, they go make your food, then they do your dishes. And we can use the whole team to speed that process up and just take care of some more folks, be a little more efficient. So that's what we're working on there, just some process improvements with that. They continue to provide Narcan training to the jail staff, and they have also been providing hepatitis A vaccine for the jail inmates that need it there as well. And then as far as the health officer, for me, just wanted to say that the pay study results came in, and so the pre-appeals are due at the end of the week, and so that process is moving forward. I'm sure you're aware of that if you're on the board. And then I just wanted to say welcome to Bridget. Again, nice to have you. And I would like to invite you that if you would like, or you have time, and you would like to have a one-on-one, it's something that I've asked everybody to do. I've been here for 3 months as the health officer, and Joe and Ron too. If you have time in January, some of your time off, you come visit me in December or January. I've talked to everybody else except for you three. So if you would like to extend that invitation. So welcome. And I think that's it for me.
The end of your list?
That's the end of my list.
Then we move on to number 9. Carol's going to give us a review of the agency budget and vouchers.
The vouchers, I didn't get the copies made for you tonight, but from last month.
Carol, put on your microphone. Thank you.
From last month to now, this present, we spent around $24,000, which now I, in turn, will be billing. Majority of it was COVID expense, because we did have an increase, as you heard in our numbers, which means that our staff is more involved in contact tracing and doing some of the follow-up with the vaccinations, as well as the salaries for the tracers. For our budget money here, public health, as you know, I funnel all the expenses and income through public health, and we are definitely over our expenses for the year, but then if you look at the revenue, that offsets the expenses. So this money that we're getting will help what is being asked at the levy for public health. So that'll shake out more in February. We'll be able to see a little better picture of that. As far as our other grants, they're coming to an end. So now, the remainder of the year will be put on the public health salary because the contracts are all expended. So any further questions at all? Thank you.
Item number 10, the next Board of Health meeting, December 21st at 6 p.m. I will not be able to attend. I'll be out of town.
I wanted to make the ask. I do think that that I would like to have a December meeting. I think it might be short, but I haven't yet had time to propose a disease investigator position, which I'll hopefully have squared away in a month and ready to present for a vote for you guys at that time. And so if we're able to have a quorum, I know that's the week of Christmas, and I don't know folks' vacation schedules and stuff, if we think that might be possible. If we need to maybe move the meeting up a week, and just wanted to ask how people felt.
I'm good the week before.
Week before works for me. Move it up a week.
This is Kim. Either is okay with me. I'm fine with either one.
Okay. So I think my suggestion would be we'll shoot for the week before.
So December 14th at 6
Yes,
p.m.?
That's the date.
Yep, that's the week.
that's the week before the 21st.
Yep.
Well, okay, yeah, we'll aim for that. If there's no need, unless something major comes up in the next 3 weeks, I guess. If there's no need, and I'm not prepared to present that position, it may just get canceled if that's okay. But if I have that position up and ready to go, I will be trying to have a quorum so we can at least have a vote.
So we'll tentatively set our next Board of Health meeting for Tuesday, December 14th at 6 p.m. unless we are canceling for the month of December. Okay? That's okay with everyone?
Yes.
Sounds good.
Okay. Then there were some people from the public here that may wish to speak before we adjourn. Come on up to the podium or sit, yeah, either way.
Okay, doesn't matter.
State your name and.
Hi, my name is Larry Hoekstra. I pastor the Osseo Community Church, and I just had some questions that I'd like for you to answer if you could. First one, sure be nice if you folks had name tags so I could tell who's what, where. And because I don't know, I know Ron, and to his chagrin, he knows me as well. But anyway, if that would be something you folks could look at, that would be helpful. The first question I had was on health equity. You had mentioned and talked about health equity. I guess my question is how is that going to be applied? Is it going to be applied equally to vaxxed and non-vaxxed, et cetera? Or is there going to be some various differences one way or the other?
I don't think that vaccine status would play any role in it whatsoever, and there's not necessarily an application at this point. It's more of a explanation and bringing exploration and bringing folks to the table and talking to them about what are some of the needs, identifying some of the disparities in healthcare access to any services. I don't know that vaccine status is on the radar for any of that. So.
All right, thank you for that answer. The second thing that I did want to bring up is I looked at the data that I could find anyway on Trempealeau County, and I did find that there were 5,271 cases of COVID, at least that was what I could see, and with 52 deaths. That is 0.00986% or less than 1%. I guess my concern is why there seems to be such a huge effort onto this theoretical pandemic, when it seems to me that the facts do not state that it is that serious of a situation. And I wanted to find out from the board, how are they, is it the top priority, or is it something that is down 3, 4, 5, 6 on the list?
Beth, this is Sally.
Sally?
Just as a reminder, under Wisconsin public open meeting laws, we aren't actually able to engage in conversations with people who are in the public comment section. They're welcome to offer public comment and everything, but we are not allowed by law to actually engage back and forth.
Not really. Something about we're not allowed by law to do so.
Public, she said the public engagement, there's no public engagement because when you're
Open meeting laws, public comment period is just for the public, and then people on the board cannot actually engage with the public during public comment period.
Okay, I guess I was just questioning as what priority the board was putting on this, or the committee is. It seems to me that it seems to be much larger than what it really holds as far as importance. But if you can't answer, I understand that. And then my third question, if you would, studies have shown that ivermectin and hydroxychloroquine and also Regeneron, many of those have 100% recovery rate with early detection and early prevention or early diagnosis. And yet it seems to be many of our hospitals, I have people that I know from my church that went to a hospital, I won't say their name, but they went there and they asked, well, can you give me ivermectin? They said, well, we have it, but we're not allowed to give it to you. And I wanted to find out how the health department committee, how you folks view that. Are you investigating this with hospitals to say, why are you doing this? Why are we not treating people until they're so terribly sick? As an example, my daughter was extraordinarily sick and went to, again, a hospital, and they said, we will not admit you because your oxygen level hasn't fallen far enough. Once it gets down to a certain level, then we will admit you. And I find that part of what I was asking, I guess, with health equity as well. It doesn't seem reasonable. And so I wanted to find out, is the county looking into those things, and how are they going to address it if they do find that? And it may not be something you can answer today, but I sure would like you to look at that.
Anything else?
Oh, I do have. I
oh.
thought maybe someone's going to answer.
Oh, no, well, we can't comment because this is public comment.
Okay,
It's not
sure.
an agenda item, so.
Okay, that's fine. And then today, I was reading that one of the chief executives of Bayer, you heard of Bayer and aspirin, came out and said that the current vaccine is not a vaccine at all. It is gene therapy. And because it is gene therapy and not a vaccine, it really is experimental. And again, I'm asking the county, please, would you do some research on that to find out where we stand as a county on those things? And then my final question is, has the county, or have you determined, or has you made a recommendation as far as employer mandate or employee mandates for vaccination, either for county employees or for municipal employees or whatever? If you could address that, I would like to know what the position is of the county on those things. And so you may not be able to get an answer, but I see Ron fairly frequently, so I'll ask him. All right, thank you.
Thank you for your questions. We'll certainly look into those and hopefully find an answer next month for you.
I hope his daughter's okay. I hope she's doing well.
I'm sorry. But
She said she hopes your daughter is doing okay.
Oh, yeah, she's finer than frog's hair.
He said, yes, she's finer than a frog's hair.
Yeah.
Well, that's pretty fine, and I'm glad to hear that.
She said that's pretty fine, and she's glad to hear that.
She took ivermectin.
Okay, there.
There we go, thank you. Hello, my name is Mike Franks. I have just a question, if we could. I'll attend the next meeting, because it's great to see you all here. Hey, but I do have a question. Could you research, please, how many, you mentioned a shortage of ventilators and people having to be moved 100 miles to get to one. If we could find out maybe how many people recover after being placed on a ventilator. Because my own family, we have a 2 for 0 recovery rate after ventilator. A brother and a nephew. Thank you.
Thank you. Anyone else from the public that wishes to speak? Second call for the people here, if you wish to speak.
I'm good. Actually, I do.
Oh.
Changed my mind. Hello, is it on? Yep. My name is Jim Franks from Osseo. And I guess since we can't ask a question, we can make a comment. My wife works for Mayo in Osseo, and the threat right now is she's going to be fired because she won't take a vaccination, which is an experimental drug that hasn't been proven to do anything. So just wondering what you guys can do about keeping the people in Trempealeau County employed that have been working through this whole COVID pandemic for the last 2 years, and they were frontline workers and hometown heroes, and now they're threatening to fire them all as of January 1st or January 3rd. And December 3rd, they're going to find out if they got their job. And there's quite a few employees that don't want to take this because either they're pregnant or they're having children or they don't feel comfortable taking the vaccine, or we know people that have died from blood clots after taking the vaccination. So, you know, they shouldn't be allowed to just fire their employees that have been working hard this whole time. And I think that Trempealeau County, the health director, ought to step up and do something about this and stop Mayo and the other employees, or the other employers that want to fire people.
Thank you for your comments. Oh, we have someone else?
Okay. My name is Tracy Todd. I live in Arcadia. I would like to ask the board to reconsider having the vaccination clinics at the schools. I just think this is children. If parents choose to give a vaccination to a child, it should be somewhere other than their public school. My children are not going to school on those days that they're scheduled, and I don't know what the attendance is on those days, but I just want you to reconsider having them at the public schools. They can go to their doctor's office, they can go to Walgreens, they can do whatever, but not at the public schools. This is a place that you get educated, not to get a shot. So that's it.
Thank you. Anyone else? This is my third and final call for anyone here in the room that wishes to make a comment. Then we are at the end of the agenda, and it's 6:48. I will adjourn the meeting until next month, December 14th. Thank you all for coming. Thank you for the public being here. This is unusual that we actually have people show up.